Welcome to Project ADHUNA. I, Dr. Neharika Malhotra, along with Dr. Jaydeep Tank, will be explaining you PPH and emotive bundle. In 2020, approximately 800 women died daily from preventable causes related to pregnancy and childbirth, translating to one woman's death every 2 minutes. In India, MMR stands at 97 per 100,000 live births. More than 30% of the maternal deaths are attributed to complications during labor and childbirth. Postpartum hemorrhage (PPH) is the leading cause behind maternal mortality during childbirth in India, contributing to almost 38% of all maternal deaths. PPH is defined as any amount of blood loss that has the potential to deteriorate the general condition of the mother. Causes for PPH may be considered to relate to one or more of the 4 T's: tone, abnormality of uterine contractions; tissue, retained products of conception; trauma to the genital tract; thrombin, abnormalities of coagulation. Active management of 3rd stage of labor is strongly recommended. It is a prophylactic intervention that helps deliver the placenta after the birth. It involves uterotonics, delayed cord clamping, controlled cord traction, uterine massage. It is strongly recommended and it reduces the risk of PPH. It is well established that carbetocin can be used for prevention of PPH. The CHAMPION trial which happened resulted in long-acting and does not require prolonged infusion. Carbetocin is stable at room temperature, can be administered via single IV injection with no need of repeated injections, possibly less requirement of any additional oxytocics. The summary of this trial resulted that carbetocin is room temperature stable. It was non-inferior to oxytocin for prevention of blood loss of at least 500 ml or the use of any additional uterotonic agents. There was no significant difference between the 2 groups in the measures of bleeding or any adverse effect. These data inform care of women in parts of the world where a lack of heat stability is a barrier to effective prevention of postpartum hemorrhage. Emotive bundle is the WHO recommendation to detect and treat PPH. E stands for early detection and trigger criteria. M stands for massage of uterus. O, oxytocic drugs. T, tranexamic acid. IV fluids. E, examination and escalation. Now I invite Dr. Jaydeep Tank to take this lecture further.
Thank you, Neharika. I strongly believe that the use of room temperature stable carbetocin is certainly going to reduce the incidence of postpartum hemorrhage. It will primarily do this not simply because it is a better drug, but by virtue of the fact that it is room temperature stable, we will be using the most efficacious form of a drug for the prevention of PPH. However, even if we have a new and extraordinarily capable drug, we will still need to watch for PPH, and the emotive approach helps us to do exactly that. It has always been believed that one of the major problems of PPH is the way we make a diagnosis of PPH. Even in this day and age, the diagnosis of PPH seems to be mainly visual. We look at a patient who's bleeding excessively, we feel that this patient is bleeding excessively, and then we make a diagnosis of PPH. This brings with it a myriad set of problems by which either the amount of blood loss is underestimated, or because the diagnosis is visual, different people see the blood loss at different points in time and fail to connect the dots, which leads to a delayed diagnosis. And that is why when you look at the emotive approach, the E, which stands for early detection and trigger criteria, is extraordinarily crucial. What this approach does is use calibrated drapes for blood loss collection with trigger lines at 300 ml and 500 ml for gauging how much blood loss has actually occurred. This quantifies the diagnosis of the amount of blood that is lost, and by quantifying this, it changes what was previously a subjective diagnosis to an objective one. I am delighted to share that FOGSI has done yeoman's work in designing these drapes and making them available for larger commercial use. The second component is uterine massage. This is something that we have done very often, but it is important to remember two things. One, how the massage is done, and you must remember that you have to look at the uterus and look at the top of the uterus and make sure the uterus is adequately compressed. And the second is the time taken to massage the uterus before coming to a conclusion that there is atony. So, massage the uterus in the right fashion and massage it for an adequate period of time before you say that perhaps this massage is not working. If you have given a prophylactic and it has not worked, then of course you need to use oxytocin drugs. The first line is of course oxytocin, but in case you don't have oxytocin or you think that you need a more potent drug, there are other drugs which are available like ergometrin, carboprost and oral or rectal misoprostol, which is to be given in the strength of 600 micrograms. So if you look at the evidence, it's a sequence of events. What the emotive approach does is translates clinical action from calibrated action to something where you do everything, everywhere, all at once. And therefore, although you wait whether the drug is going to act or not, you also do not wait too long, and then you use oxytocin, PGF2, methyl ergometrin and then misoprostol in rapid sequence. Tranexamic acid is extraordinarily helpful when you are treating PPH. The indication of tranexamic acid for use in prophylaxis of PPH has not yet been approved. There are studies going on and we look forward to the results of these studies. So if you have a patient who has a PPH, you use tranexamic acid in the appropriate dose and very importantly at the appropriate time. If you delay the administration of tranexamic acid for too late, you will find that it is not going to be very useful. IV fluids, of course, are the cornerstone of resuscitation when it comes to hemorrhage. And the key item or consideration in IV fluids is the size of the cannula that is used to administer IV fluids. This is because of Pusey's law, which says that small changes in the diameter of the caliber of the vein flon translates into very large changes in the speed with which you can administer those IV fluids. So for example, if you consider the fact that 16 gauge vein flon can transfuse so much more faster compared to the pink or even sometimes the blue vein flon that is used, it would make appropriate sense to try and get IV access for a 16 gauge vein flon as soon as possible when you are suspecting hemorrhage. Finally, examination and escalation. If you think that things are not working out and the patient is having an inordinate amount of blood loss, you have to examine the patient, rule out other causes like trauma, etc. And sometimes remember that it's important to do this examination under anesthesia, particularly when the vagina is friable after a prolonged labor. Do not hesitate to take the patient to the theatre. give her a regional anesthesia and examine the vagina carefully to make sure that you're not missing out on any form of apical or cervical tears. Finally, if all the medical management does not seem to work, you do need to move on to surgical management. And I've always believed that your surgical management and the threshold for initiating surgical management would in a way depend on the resource setting in which you are practicing. For example, if you are working in a high-end hospital with a very good ICU, your threshold for surgical management could perhaps be a little higher than if you are working in a low resource setting. Remember, if you are going to do a hysterectomy, it's better to do it sooner rather than later. Of course, PPH does not mean please perform hysterectomy, so you need to look for your incidence of hysterectomy to understand that you are not overdoing it. To conclude, as Neharika very succinctly told you, use AMTSL, RTS carbetocin, not because it's a better drug, but because it arrives to you in a much better and efficacious form, will be a game changer. Use the emotive approach, particularly the drape, because it means that you are translating a subjective diagnosis into an objective one. And when you do suspect PPH, try the bundle approach and try not to delay action too much. Calling for help is crucial. Don't try to do everything on your own. Two hands in this instance are usually better than one. Thank you very much, and I wish all of you a safe and PPH-free practice. Thank you.